All right, Dr. Ratnasai Petsawan, I would like to invite you to open up the session for our annual general meeting for the Surveillance and Response Working Group.
So thank you very much for the introductions. Colleagues, ladies and gentlemen, I'm very pleased to welcome you to the 2021 APMEN Surveillance and Response Working Groups annual meetings. Although we miss many of the nuance of in-person meeting, we nevertheless are determined to host a quality and not more engaging and fruitful session for the year's proceedings. Throughout the years, APMEN and the three working groups have been the cornerstone to engaging dialogues and supporting ongoing information exchange across country partners and partner institutions in the Asian Pacific. Furthermore, our close partnership with the Asia Pacific Leader Malaria Alliance, with host leaders and all the key stakeholders in the regions, has enhanced our strong commitments to eliminating malaria in the Asia Pacific by 2030. The COVID-19 pandemic has highlighted the need to remain vigilant and adaptive to changing public health landscapes. The strength of our programs has been tested over the past 2 years, and we share a common challenge to maintain the hard-fought progress that were achieved in pre-pandemic times. Since the last annual meeting in 2018, the context of our fight against malaria has changed significantly, and so will our efforts. Colleagues, ladies and gentlemen, the theme for this year's annual meeting is Data to Eliminations, prioritizing gaps in research and capacity developments for surveillance and response. Under the new hosting arrangements, whereby I have taken up sharing this working group with Professor Richard Mode from the Mahidol Oxford Tropical Medicine Research Unit, our goal is to reorient the working group priorities based on the program's needs with regard to malaria surveillance activities. With your feedback and guidance, we wish to strengthen the SRWG as a platform for impact. Over the 3 days, we will collaborate on identifying the ways to build capacity for eliminating through research, data quality, and trainings. Today's proceeding will be guided by the themes of building capacity through research, the fight towards effective eliminations need to be evidence-based and grounded on well-researched tools and procedures. I'm confident that this arena, which has collected the brightest and most hard-working minds in our field, is more qualified to deliberate on what research is needed to support malaria eliminations in the Asian Pacific regions. What we have learned over the past 2 years is that innovation in both the tools we use and the way we work will continue to be vital for overcoming both past and recent challenges to reaching eliminations. The theme on day 2 of our proceeding will be focuses on building research through data quality and technologies, during which we will explore challenges and barriers to ensuring the quality of surveillance data and identify possible solutions, including through the use of technologies. Additionally, understanding the challenge at the ensuing stage of surveillance data utilization for response, and also indispensable to our efforts. As such, day 2 proceedings will also seek to identify the challenges and barriers to integrating epidemiological and entomological data, and explore the use of downstream integration of surveillance data for developing appropriate response and interventions. Finally, when thinking about how to sustain our malaria elimination efforts, we must not neglect the significance of continued learnings. providing ourselves and our program staff with the relevant resources to remain effective and empower in our respective roles, we have to ensure that our programs stay resilient. Therefore, I hope you will remain with us until the last day to contribute in designing training modules that will reflect the needs of our programs. On this note, I thank you, our distinguished speakers, facilitators, the coordination teams, and our friends and colleagues who have tuned in from across the regions for your participations, and wish you all successful deliberations across the 3 days meetings. I thank you, all of you.
Thank you very much, Dr. Ratanasai, for your opening remarks. So I will just invite Dr. Ms. Amita Chebi, who is the Senior Director of APLMA and APMEN, to provide us with a bit of an introduction on the APLMA.
Thank you, Marina. It's a pleasure to be here. Thank you, Dr. Ratanasai. It's been an absolute honor to have you chair the Surveillance and Response Working Group alongside Professor Richard Maud. I know we greatly benefit from your leadership and your technical expertise, and looking forward to the future of the working group under your stewardship. So I know that my session is called Introduction to APMEN, but I'm hoping that most people on this call today already are very familiar with APMEN and the working group, and all that we hope to accomplish through the working groups. Just very quickly, APLMA and APMEN were brought together around 5 years ago in 2015, and the two joint secretariats are now co-located in Singapore. And a key element of that integration was to make sure that we now have a consolidated regional platform that focuses not only on technical engagement, but also on senior level political advocacy. Over the last 5 years, I think we've had some successes with making that linkage from technical engagement to advocacy work, but we clearly have a long way to go still. Earlier this year, the APLMA-APMEN Secretariat developed a 10-year strategy, or a 10-year vision really, around what else is it going to take for us to accomplish the 2030 elimination goal. And an important element of that 10-year strategy is this integration between APLMA and APMEN, and how we can really unlock the value that exists within our combined platforms. So some key themes in the 10-year strategy that some of you have had the chance to provide feedback on. One is a focus on high burden geographies. I think across the region, there's recognition that unless we focus on the critical geographies of India, Papua New Guinea, and Indonesia, the region as a whole is not going to be able to achieve the elimination goal. So what is it that we can do in the remaining time that we have to really provide additional support to these countries? The second piece is around support on technical advocacy to countries in the GMS as they make this transition from control to elimination, and particularly in the context of donor transition as well. So several colleagues on this call today, I know, are from the GMS. This is a very live topic for them, and APLMA and APMEN stand ready to provide support that is needed, both from a transition perspective, but also with technical engagement from control to elimination to prevention of reintroduction. And the third piece of our 10-year strategy is really a focus on near elimination countries. So we, of course, have the WHO's E2025 framework that focuses on countries that hope to achieve elimination by 2025. But a key challenge that's facing these countries is in the context of cross-border collaboration. So how can we as APLMA-APMEN provide support to these near elimination countries that in most cases are actually bordering the high burden geographies that I referenced in the part one. So those are some critical pieces that form part of our 10-year strategy. Now, with respect to the APMEN working groups itself and the role that they can play, we've talked about integration, integrated engagement, and now in this next phase of our work together, we'd really like to focus on specific elements of that integration. What does it look like? as Dr. Ratanasai mentioned earlier today, I think the working groups and APMEN platform have done a tremendous job of, sharing information, of being a platform for technical exchange. But in addition to just exchange of information, how can we make that shift to implementation, to supporting the countries, the national malaria programs, make that journey towards elimination? What is it that they need support in terms of capacity strengthening, introduction of new technologies maybe, or even the piece around data and surveillance systems? I think COVID has really continue to emphasize the importance of surveillance as a key backbone of a public health system. And I think this working group in particular is really critical to malaria elimination, as it's cross-cutting across the other two working groups as well, whether it's VIVAX or vector control. So how do we, through this working group and the work that we do with partners here, make sure we lay the strong foundation for elimination and for broader public health security in general? I'm really looking forward to these discussions over the next 3 days. As always, we hope that the APMEN working groups are able to elevate and raise specific issues that we can then use for advocacy with senior officials. In that context, I do want to mention that this year, APMEN and APMEN are supporting, along with the Royal Government of Bhutan, a virtual high-level leaders dialogue in December. This meeting is scheduled for December 13th. It is not a senior officials meeting like the format we've had in the past, but it's a smaller truncated version. But the goal is still the same. How can we use that platform to make sure that countries recommit to the elimination goal? How do we use that platform to focus attention on critical technical gaps? And so this meeting over the next 3 days will be really critical to helping us identify specific issues that we can take up with senior officials at the leaders dialogue. So looking forward to the deliberations. Thank you again for joining us today, and have a great meeting.
Thank you very much, Amita, for your introductions. Next, I would like to invite Professor Richard Maud, who is the head of epidemiology department here at Moru and also the co-chair for APMEN Surveillance and Response Working Group. Richard will give us an introduction to the days and the proceedings of the next few days. And Richard, whenever you're ready, I will leave the shared screen and you can take charge.
Yeah, thank you, Marina. Great. So thank you very much for the opening remarks to our chair and to Amita. Just to say hello to everybody that's joined, and very welcome to our APMEN SRWG AGM for 2021. On behalf of Moru, we're very excited to be the hosts of the SRWG for this year and for next year. And for this AGM, we've put together a focused agenda aiming to identify and begin to address some of the gaps in research and capacity development for malaria elimination across the Asia-Pacific region. So there'll be 4 sessions over the 3 days, and I'll just take you through them quickly. So at each of the sessions, there'll be some talks followed by a breakout group. And there'll be support from our team of facilitators. You can see some of the names on there. So you'll get to know those people over the next 3 days. And for all the sessions, we plan to do a Q&A after each set of talks. So if you put your questions in the chat or raise your hand to speak during the Q&A period. We encourage you all to join in the breakout group discussions and contribute your expertise and opinions. And we'll be recording the meeting, and there'll be note takers that join sessions to document some of the key points. And we'll be using those notes and our own notes to prepare a meeting report, which we'll share with participants. And then key findings will be shared with relevant stakeholders and published in the academic literature. If you have any technical problems during the meeting, then you can reach out to one of our support team, and you should see them in the participant list with support team after their name. So you can message them directly. Session 1 today is on building capacity through research, and it will last around 2 hours. And for this, participants will be split into groups for a brainstorm to identify priority gaps in research needed to support elimination efforts across the region. We'll be collating the lists from all the groups of those priorities and putting them together for you to vote on over the next couple of days to select the most important topics. And then we'll announce the results of the vote at the end of day 3. Tomorrow is the longest day of about 3 hours, and there'll be 2 sessions, session 2 being on data quality and integration for malaria surveillance. And we have 2 talks from the WHO Global Malaria Program team on the new surveillance assessment toolkit, which many of you have heard a bit about already, and also on use of entomological data for decision-making, including integration with epidemiological data. The group work in session 2 will be split into 2 groups, one covering data quality and one covering data integration. And data quality, we're hoping to identify challenges and solutions for ensuring high quality surveillance data to guide decision-making. And then for data integration, we're hoping to identify challenges and solutions to integrate particularly epidemiological and entomological data to guide responses by national programs. So these are priorities that have come out from our various discussions with countries and also from our training needs assessment survey. Session 3, we'll talk about technical solutions for malaria elimination, including some talks from the Digital Solutions for Malaria Elimination lead from WHO. That's a big network of technological partners which have done a lot of work to develop different apps and online resources for malaria, as well as DHS2 from the development team, followed by examples of digital technologies for malaria surveillance and data visualization from the national malaria programs in Sri Lanka and in Cambodia. And then the final day, day 3, will focus on capacity building through training. And this will start with some presentations from the RBM Surveillance Monitoring and Evaluation Reference Group on upcoming initiatives and training resources. And then following that, Messiah will talk about our recently completed training needs assessment survey of APMEN member countries and partner organizations. This TNA has identified 4 priority topics under which the national programs would like to receive training. So the group work will focus on each of those 4 topics and then help to decide more about the content, formats, and the audience for the training activities that we have planned in the coming months through the SRWG. So just to finish, on behalf of Moru, we're very excited about this meeting and we look forward to the upcoming deliberations and especially the outcomes. Thank you to everyone.
All right, thank you very much, Richard. So we want to just do a group photo. Would it be possible for everyone to turn on their cameras for a short second as we do that? Phone, will you do the countdown for us?
Could you please stop sharing screen?
Yep, 1 second. You're on mute, phone.
Yes, I'm finished.
Well, thank you everyone for turning on your camera. Thank you for all the speakers during our first session. So I'm just going to move right on to the next session today, which we will start with building capacity through research. And I would like to invite Dr. Abdul Majid, who is the advisor Malaria for Policy and Strategy at the Project Management Unit for the Directorate of Malaria Control in the Government of Pakistan. So Dr. Majid, whenever you're ready, you can turn on your screen and you can start the session off.
Thank you, Messiah. Thank you for the introduction. Ladies and gentlemen, I would like to thank APMEN and Surveillance and Response Working Group meeting for arranging this annual general meeting. I think the theme, data to elimination, is very important, and especially the theme which we have selected for this session is building capacity through research. I think this is very important, and the 2 key words I would say, capacity and the research especially, are very much important, so that we can proceed to elimination. The different countries, based on their endemicity level, may have, and other factors, may have different research needs. So today's session would be to focus on identifying the research needs based on your respective countries, endemicity level, and then to prioritize them. The purpose would be, of course, to support the elimination in order to improve the tools, to have better interventions. So the session objectives today are to identify the research priorities needed for elimination, one, and second one is to discuss the prospective research interests not currently being implemented in respective countries by the respective organization. And the third one is to identify top 3 research priorities and discuss their significance. So for this objective, the sessions would be, the support team, APMEN support team would be having the breakout sessions. The participants would be divided into 3 main and NMCP groups and non-NMCP groups. So we have like group 1, which is Great Mekong Subregion Plus, and the facilitator would be Dr. Julian from Chai, and the countries would be Cambodia, China, DPR, Korea, Laos, Myanmar, Thailand, and Vietnam. And for this, for the group 2, it would be South Asia, and the facilitator would be Sazid, and the from Moro, and the participants would be from NMCP, Afghanistan, Bangladesh, Bhutan, India, Nepal, Pakistan, and Sri Lanka. The group 3 is the Melanesia and Malay. This group would be facilitated by Dr. Tania, and the participants would be from Indonesia, Malaysia, Papua New Guinea, Philippines, Solomon Island, Timor, and we have Leslie. So basically, the group 3 would be, of course, the non-NMCP group, which is group 1, and the facilitator would be Dr. Frank from Moro, and non-national malaria program partners and institutions. Group 5 is non-NMCP group again too, and would be facilitated by Dr. Christio Moro, and non-national malaria program partner institutions. And group 6 is again non-NMCP group, would be facilitated by Rikita from APLMA, and non-national malaria control program and partner institutions. So the support team would now divide the participants into the breakout session based on these groups. And the objective is to have discussion and identification of the research priorities, and to come up with the 3 key research priorities from your respective group. We would identify one key, 2 to 3 groups to present on their research priorities. And I think the time given is 40 to 45 minutes for this group work. Next slide, please, if I have any. Yes, so I think we break out into the sessions, Dr. Messiah.
Yeah, we're gonna organize everyone into the respective sessions. Thank you very much, Dr. Majid, for your introductions. So Dr. Phone is just going to split up the groups into the groups that are mentioned on this PowerPoint slide. So there's no need for anyone to self-select. Give us a second to put you into the respective groups. And at the end of your breakout session, you will be automatically pushed back into the plenary. And as Dr. Majid has mentioned, we will have a short presentation section following the discussions. So just give Dr. Phone a second. He will be
Yes.
Just
everyone
to-
into the groups.
Yeah, just to add, with the 3 key research priorities, we would also expect a brief note on significance of each research priority as well. So these are the 2 key outcomes we would expect from this research, from this group.